Assalamu alaikum. Good afternoon, everyone. It's my pleasure today to introduce Dr. Mohammad Al-Semari. Dr. Al-Semari is a graduate of the Acroplastic and Orbit Fellowship, and we're glad to have him with us in the Acroplastic department at KKISH as an associate consultant. Dr. Al-Semari is one of the distinguished young ophthalmologists, and this afternoon he will tell us about the telemedicine use in ophthalmology during COVID-19 crisis. We had a project of telemedicine last year during the COVID, and I'm sure Dr. Semari will shed some light on that project and will tell us also about the use of telemedicine in general. I'm excited to hear his presentation, and we can start, Dr. Mohammed.
Thank you, Dr. Osama. Thank you for welcoming me. Good afternoon, everyone. Ramadan Kareem. Allah تقبل منا ومنكم صالح الأعمال. Today, I will talk about the telemedicine use in ophthalmology during COVID-19 crisis. I hope my presentation is appearing in your screen. Is that right?
يا دكتور واضح الله يعطيك العافية.
Okay, my objectives for today, I'll talk about introduction, telemedicine use in ophthalmology subspecialties, telemedicine in oculoplastic and orbit, and what has been done in our clinic at KKISH, and then a conclusion. I have no financial interest to disclose. Telemedicine engages advanced telecommunication technologies to provide patients remotely with various healthcare services, including assessment, diagnosis, management, and follow-up. In the field of ophthalmology, the interest in telemedicine started more than 40 years ago by the use of well-trained ophthalmic technologists who travels to rural areas in Canada and carries out the necessary refractions and screens patients selected by the local nurses for ocular diseases. Patients requiring treatment or further investigations are referred to the supervising ophthalmologist, who will provide instruction by phone or radio, or will see them on a subsequent visit, or if indicated, will have them evacuated to the well-equipped treatment center in another bigger city in Canada. Thereafter, the advent of new technologies and evolvement of variable imaging modalities led to the steady growth of teleophthalmology. Teleophthalmology can be provided to patients via two major modalities, either asynchronously, like store and forward, like in photos, or synchronously, like real time in videos. In the asynchronous model, patients' clinical data and photos are captured and forwarded securely as digital files for review by an off-site ophthalmologist who will assess and generate a diagnosis and management plan, which will be later relayed to the patient. In the synchronous model, there is instantaneous communication between the ophthalmologist and the patient or referrer through video conferences usually. Although this model has the advantage of enabling the treating physician to inquire in details about the patient's clinical condition, it mandates a safe, fast, and wide coverage of internet connection, which eventually might constitute, particularly in some areas, a limit of its use. Until recently, teleophthalmology was mostly utilized in screening programs or in rural settings and regions with difficult access to ophthalmic care services. As the world is battling the novel severe acute respiratory syndrome coronavirus 2 pandemic that is highly contagious, the medical community was forced to seek safe alternative means to provide patients with medical services without compromising both parties' health and well-being. Although utilization of personal protective equipment by ophthalmologists were recently emphasized by American Academy of Ophthalmology, ophthalmologists in general are at prolonged and close contact with patients, placing physicians and patients at risk of infection. Although patients suspected for COVID-19 infection are apparently less likely to present initially at the eye clinic, preliminary data suggests that nearly a third of COVID-19 patients may have non-specific ocular manifestations consistent with conjunctivitis, such as epiphora, conjunctival hyperemia, and chemosis, similar to finding found as the result of other human coronavirus infection. The potential convenient operation of telemedicine during disasters or pandemics has been described previously. As a result, many medical services worldwide are currently being delivered distantly to patients. Thereby, this public health emergency is serving as a real eye-opener to this underscore technology. During COVID-19 pandemic, social distancing has pushed industries into remote operations, and this can be as a new normal after this pandemic. It is essential to notice that some subspecialties are more amenable to teleophthalmology visits than others, such as oculoplastics, neuro-ophthalmology, and pediatrics, because much of these examinations can be performed externally. So what about telemedicine in ophthalmology subspecialties? I will start with this largest study by Patil et al. Studied the implementing live video conference appointments in late March 2020 for a period of 3 months. 840 patients received ophthalmic care among all subspecialties at the Vanderbilt Eye Institute in Nashville, USA. Of these, the majority, nearly 80%, were either follow-up or post-op visits. I'll talk briefly about how the process flow of their study. The providers need to review the clinic schedules in advance and stratify patients into different categories based on level of urgency. A color coded was adopted within the EPIC electronic medical records to convey which patients require in-person evaluations and which patients were suitable for telemedicine visits by the treating providers. Trained patient service representative work to contact patients and relay the provider's recommendations. Then medical students volunteer to teach patients remotely how to set up their computers or smartphones, and technical staff contacted patients before their scheduled visits to confirm there were no change in health status or medications. Live ophthalmology visits were more amenable to certain ophthalmic subspecialties, with pediatric, neuro-ophthalmology, and oculoplastics encountered more than 80% of all telemedicine visits. And as you can see in this table, the distribution of telemedicines from the same period as their study by Patil et al., you can see the total number of patients among all subspecialties, and we can see the bulk here in pediatric. In pediatric, plastic, and neuro-ophthalmology, reaching around 80% combined. And they explained they found difficulty in enrollments of glaucoma patients, retina patients, and early post-op patients. And they explained that the glaucoma patient, they will find difficulty to measure intraocular pressure in live teleophthalmology visits. And in retina patients, because most of their retina services was intravitreal injection, so they found difficulty to treat that by teleophthalmology. And in early post-operative patients, especially in glaucoma, post-glaucoma retina and corneal surgeries, they will find difficulty to elaborate or to examine the intraocular inflammation. So overall, this table is striking me regarding the total amount of reduction in in-person visits during COVID-19 in their institutes. Overall, there was nearly 70% reduction in in-person visits, and these scheduled patients for non-urgent conditions by the treating providers were successfully postponed until ramp-up. A total of 18.5% of all visits were conducted virtually. Here in this table, we can see the total number of average daily in-person visits before Corona, around 261, and average daily in-person visits following telemedicine implementation, around 79 patients, with a reduction of 69.8%. So they conclude that live video telemedicine is a sustainable and safe care delivery approach to extend ophthalmic care delivery during the COVID-19 pandemic and even post-pandemic. On the other hand, Sommer et al. Described a nice review article regarding telemedicine in ophthalmology in review of the emerging COVID-19. From January 2017 up to March 2020, with 90 records were included in the final qualitative analysis. Their highlights are teleophthalmology is an effective screening and management tool for a range of adult and pediatric acute and chronic ocular conditions. It is mostly utilized in screening of retinal conditions, such as ROP, diabetic retinopathy, and age-related macular degeneration, in diagnosing anterior segment conditions and glaucoma. With improvement in image processing and better integration of the patient's medical records, teleophthalmology should become a more accepted modalities. Although this review article involved a few months from the COVID-19 pandemics, but I didn't find any articles who studied the COVID-19 or patients in COVID-19 period. Boy et al. Describe about the best practice for virtual visits in ophthalmology. Over 3.5 years of conducting more than 350 ophthalmological virtual visits, their group has gained numerous insights into best practice. This communication shares these experiences with the medical community to support patient care during COVID-19 crisis and beyond. They use a commercially available health insurance portability and accountability compliant platform that integrates with their scheduling software and provides a virtual waiting room. Disadvantages, as described by the authors, are that it requires a software download by the patient and a link within an email to access the virtual waiting room. In this table, they elaborate some tips for successful virtual visits, including position of the device, positioning of the patients, and the lighting, and how to look at when counseling, how to look at the camera, and etc. This table describes the methods that they have found useful regarding virtual examination maneuver. And this include visual acuity in different age group. They also include the external examination, eyelid and adnexa, ocular motility. So what about telemedicine in oculoplastic and orbit? Kang et al. Reported successfully experience with video-based teleoculoplastic during the COVID-19 crisis, in following up post-operative patients, as well as assessing patients in need for urgent surgery. 66 patients were enrolled prospectively, with most common diagnosis was thyroid eye disease, followed by eyelid lesions and other orbital pathologies and lid pathologies. And here is this table is a full list of diagnoses seen via video consults. They found that 62% of patients prefer video consultation over face-to-face consultation, as it is safer and more convenient. They found 92% of patients would recommend video consultations to others. In addition to 94% of patients found video consultation is easy to join. So what has been done at KKISH? We have started a cross-sectional study that was conducted between April and June 2020 in oculoplastic and orbit clinic, aimed to evaluate patient satisfaction with the provided telemedicine services at KKISH during COVID-19 pandemic. Telemedicine method was conducted by generating a secured website link with specific questions related to oculoplastics in general to communicate effectively with patients in safe environments. And we'll look at Appendix 1 soon. In addition to uploading high-quality images of the eyes. After that, we have evaluated the responses of the participants and to check if there are patients need urgent in-person visit or possible urgent surgery and response accordingly. Here you can see in the questionnaire used for telemedicine appointment during COVID-19, we ask from question 1 to question 8, general questions regarding the chief complaint, which eye, the duration, and etc. And after reviewing the patient responses from above questionnaire, the physician will respond by answering the following choices, and answers will be sent directly to the patients via link. All these questions were translated in Arabic before we sent to the patients. So we sent the patients the Arabic questions, and then their response, and we have reviewed the responses, and then we respond accordingly. The impression has 4 choices: either stable, need possible surgical intervention, need urgent evaluation, or the image that was uploaded by the patient was not clear. So the plan, either routine appointment, urgent or semi-urgent appointment if need surgical intervention, or need ER visit if there is urgent or need urgent evaluation, or the choice of re-enter the link and upload image in case of the image was not clear. Also, if there is need medication refill or not, we will respond that, or other comments that we would like the patient to know, we will write it here and translate it into Arabic. So patients and physicians' responses are securely uploaded to our system for re-evaluation in next visits. Here is an example of high-quality image of right eye of 39-year-old female, 3 weeks post-canaliculotomy and irrigation of penicillin G showed significant improvement in her condition. So in this regard, we would like to evaluate this telemedicine method in that period from April to June 2020, aiming for quality improvement of this technique. We include all patients, 46 patients who agreed to participate in this project. We have generated a link with 5-point Likert scale for satisfaction scores in our structured questionnaire, which was translated in Arabic language and sent it to all participants. We have received the responses within 1 to 2 weeks after their telemedicine appointment. We exclude patients if they refuse to participate, and or patients who cannot use the link for any reason. In addition, we exclude new patients to the clinic who require a comprehensive assessment for accurate diagnosis. So this is the questionnaire, included personal data and specific questions regarding the satisfaction of the telemedicine consultations, including 5 questions. So as a result, this table summarized the personal and demographic data in addition to the type of diagnosis involved in our study. Bulk of the patients were middle-age, young adult or middle-age patients. Around 47.8% of our patients from central region, and most common diagnoses were lid pathologies and socket-related pathologies. The level of overall satisfaction with the care provided during the telemedicine appointment has been measured and found that 67.3% of the participants were satisfied and 10% were unsatisfied. The satisfaction with the telemedicine follow-up care that the patient received and found that 63% were satisfied, and on the other hand, 26% were unsatisfied. We have compared the overall satisfaction rate among the age groups, and we found the satisfaction among the group between 18 to 30 years was the highest, with 76.5% compared to the other age groups. The overall satisfaction rate between different diagnoses was compared, and we found patients with orbital pathology, dryness, and lid lesions had 100% satisfaction rate, although these categories have small number of participants. However, the rest of diagnoses varies between 75% in lid pathology to 50% in thyroid eye disease. Additional comparison made between the overall satisfaction rate among the region of origin in Saudi Arabia. We found Eastern region participant had 100% overall satisfaction rate, while in Western, Southern, Northern, and Central regions had variable percentage between 54.5% up to 88.9%. we found 41.3% of patients will recommend telemedicine for other patients with the same patient's situation. However, when we asked if they prefer the next appointment to be telemedicine appointment rather than physical appointment, majority disagreed, around 69.6%, as they prefer the personal visits. 15% were neutral, and also 15.2% they prefer the telemedicine appointment, which may explained by the lack of physical interaction between physician and patient in asynchronous telemedicine appointment. Majority of patients, 84.8%, found the telemedicine link and online questions easy to use, and 15% found it difficult. Our study on telemedicine appointment showed acceptable overall satisfaction and has the advantage of low cost effect, ease of use, and high safety during COVID-19 crisis. However, the limitation of this study include small sample size, lack of physical interaction between physician and patient, and further studies with larger sample size is recommended. So as a conclusion, the medical community has been forced to adapt to a rapidly changing practice environment during COVID-19 pandemic. This health crisis necessitates innovation and identify methods to provide safe, effective care through telemedicine and share developments of best practices for efficient implementation of virtual visits. Asynchronous store and forward model has the advantage of less cost and easier to use, but lack of real-time communication between patient and physician. Synchronous model, real-time, has the advantage of more convenient, but it mandates a safe, fast, and wide coverage of internet connection. Ophthalmic telemedicine baseline facilities are recommended for all eye care providers during this crisis and beyond. Furthermore, as technology continues to advance, we should be able to make more accurate and meaningful ocular health assessments over telemedicine. At the end, there is a special thanks to all who participate actively in telemedicine projects at our hospital. This includes oculoplastic department members, IT department, outpatient clinic, and outreach and eligibility department. Thank you.
Thank you, Mohammed, for a nice presentation and elaboration on the telemedicine project. So we'll open down the floor for questions, and probably I will start with asking you if you want to do another clinic or another virtual or telemedicine clinic. Would you do the same, or what areas that you'd like to improve in your experience?
Thank you, Dr. Sama, for this question. Well, it is. I think it is a valuable method in this during this difficult time. Yes, I will do telemedicine in our practice, especially in oculoplastic. Video recorded or video conference telemedicine visits is way better than asynchronous, as we can see in literature. But it mandates a wide coverage of internet connection. So it depends on the patients from the other side, where their location. And this is one thing. The second thing is the type of diagnosis also are important. In oculoplastic, there are some diagnoses in, for example, post-minor surgeries like bifurcation or canaliculotomy, as we can see in one of our cases. I think it's valuable to see them by telemedicine.
Thank you. If anyone have a question, he can directly ask his question. There is one question in the chat from Karam. He said, were there any specific measures setting asked from patient while taking the eye photo?
Yes, correct. We have asked the patients that they have to take the photo in 3 dimensions, in front, from the left, and from the right. So there was a specific guidelines that the patient should follow.
So probably we don't have any more questions. For that, I think we can conclude our grand round. Thank you, Dr. Mohammed, for your presentation.
Thank you, Dr. Sam, and thank you for all your attendance.